Good afternoon. I am Cynthia Tate. I'm with the Build Initiative, and I'm here today to talk to Omotunde Sowole-West um, in honor of Black Maternal Health Week. And Omotunde, I'm going to ask you to introduce yourself to the folks who will be watching this recording, and then we'll just go on and have a conversation.
Yeah, so thank you so much for doing this. I appreciate it. So I am Omotunde Sowole-West, and I also work with my colleague Cynthia here with the Build Initiative. And I currently work with the Prenatal-to-3 Hub. And I'm also a public health practitioner and a maternal health advocate in this space.
Well, that's wonderful. So, um, let me ask you this for the folks that are watching. Why did you decide to do this?
Yeah. So I like to always say that yes, this is work, but it's not just work for me. As a public health professional and as a mother, more importantly,
Mm,
I know really firsthand how critical it is to ensure that every Black woman has access to safe, respectful, and high quality maternal care. And the reason why I say that because professionally, I've seen the data, and numbers don't lie at all. And Black women are dying at an alarming rate during pregnancy and childbirth. And most of these deaths are preventable. But as a mom, this issue is very personal to me. As someone who has had three cesareans, I have three beautiful children, 9, 7, and 3. I like to say my 3-year-old is going on 13.
I know they're so cute.
Thank you.
Yes.
You know, I could too have been a statistic, but because I had a great advocate, great health professionals, and healthcare providers, I was not. The fear, the lack of trust in the healthcare system that many other Black women have, and the fight to really be heard are experience that many Black mothers share. Um, I'm doing this work because no woman should have to question whether she'll survive bringing life into the world, right? Am I gonna be able to go home and be with my family? So really, to answer your question, my hope is for those who will be watching this, is that they'll walk away not only informed, but ready to take action, right? Because we've been talking about this for many years, but now it's really time to take action, whether it's advocating for better policies, supporting Black birthing professionals, or simply really just listening and believing Black mothers when they say, this is my concern. I have a concern, not only in the hospital, but before they enter the hospital and then after they
Hmm.
exit the hospital.
Hmm. Yes, yes, yes. We want to get a little bit more into that phenomenon there, the not listening to Black women. Um,
Yeah.
well, so let's go back, and for those folks who are listening or watching to this recording, and start at the beginning. So when you say Black maternal health, what does that mean? Is that just the lack of Black maternal mortality, or is it something broader? And why should people be concerned about it?
Sure. So when you talk about Black maternal health, it refers to the overall health and well-being of Black women during pregnancy, childbirth, and even postpartum. I think a lot of times when you hear Black maternal health, you folks automatically think, oh, it's just only during pregnancy, but it's the overall health, right? So it's more than just about surviving childbirth. It's about thriving, really, before, during, and after pregnancy. People should care because Black women are 3 to 4 times more likely to die from pregnancy related issues than white women, and these deaths again are preventable. Um, it's really a crisis if you really think about it. When these mothers are dying, you're not just taking away the mother, you're taking away full families, you're taking away someone
Mhm.
from a community. So really addressing Black maternal health means confronting really racism in healthcare and improving access to quality care, and ensuring that Black women again are heard and respected. So it's not just looking at just maternal health, but the overall health and well-being of Black women.
Yes, yes, yes. And you also made another point I wanted to bring attention to, which is that when a Black woman dies in the process of um, either in the process of giving birth or thereafter, um, it affects a whole community. I've seen video, stories about the effect on dads who are then raising their children who remain without a mother, and the effect on grandmas and grandfathers, and the effect on the little children who would have been the siblings. Um, so, it's a broad effect that it has. And so, when you talk about Black maternal health and and we talk about Black maternal mortality, are you just talking? You're not just talking about dying in childbirth. You're also talking about not surviving the period after childbirth. Is that right?
Correct, and even to be more specific, Black maternal mortality refers to the death of Black women during pregnancy, childbirth, or even within that first year after delivering, due to pregnancy-related complications, which happens. And really, the scope of the problem is massive. Black women, again, face higher rates of preventable, and I want to say preventable because these deaths are preventable. Severe birth complications, often due to systematic failures. I said earlier, just not folks not listening. If someone is saying, "Hey, I don't feel well," or "I need medication," or "I think I want to have another opinion," listen. And oftentimes those things are overlooked. Those are the things that we really want to touch on. But also too, I want to talk about, we're talking about Black maternal mortality. I won't get too much in this conversation, but we also have to think about Black infant mortality is also something that is an issue. And Black infant mortality, for those who may not be familiar, is really when Black babies are dying before their first birthday. And Black infants, let's really talk about the statistics, die twice the rate of white infants, excuse me, often due to things like preterm birth, low birth weight, and inadequate maternal health care. And it circles back to that maternal health care, not getting that proper care that the mother deserves. So yes, it is a part of this larger issue when we talk about, it's not just the mothers who are being impacted, but it's
Yeah.
a larger community, a larger family issue.
Yes, yes, yes. Well, I think that's important for folks to know and to understand, because people could hear the issue and say, well, I'm not a doctor. What can I do? I'm not a nurse. What can I do? But this is a larger issue. We'll get into some more ways that people can um, um, do something about it later on. But let's talk a little bit about these racial disparities.
Mm.
So you cited a couple of statistics around infant mortality, 2 to 1, I think you said,
3 to 4 times
three to
higher.
four times
Mhm.
on infant mortality and maternal mortality. Three
So
to
for
four.
Yeah, so for maternal mortality, 3 to 4 times higher than white women. Black women are dying at an alarming rate, and we can even get more specific if we really want to talk about. And I won't go too much into it, but even when we
Yeah.
talk about the specific numbers, the maternal mortality rate for Black women in the United States, and these are is data from the Centers for Disease Control a couple years ago, is 69.9 deaths per 100,000 live births compared to 26.6 for white women. And I just
Wow.
want that to sink in. So we have to really say, why is that? Right? What are the reason that Black women are dying at higher rates?
Yes. Yes, I do. Yes, we do want to talk about that. Let me back up just 1 second and say, in general, and then let's talk about Black maternal mortality. But in general, what are the reasons for poor maternal health outcomes?
Sure. So some of the reasons, and I think the really largest reason is that systematic racism, right? Women not being heard, women not, it's hey, I have an issue or I'm not feeling well. Some of the top maternal mortality causes, we have cardiovascular disease, we have preeclampsia, blood clots. A lot of these again are preventable, but if someone comes in and specifically a Black woman comes in and they're saying, "Hey, these are my issues," and it's brushed off, which oftentimes I've read and I've heard from many Black women, then these issues become a larger issue because their concerns weren't heard of. So that then leads to these horrible outcomes, right? It leads to larger issues because this could have been something that was prevented, but because it wasn't taken as an issue, then it becomes this horrible outcome.
So these medical conditions like preeclampsia, but the other medical issues that you talked about, I'm not a physician either, but do those medical conditions occur at different rates with Black women than white women? Is the
They do.
only difference how the system reacts to them, or do they actually occur at different rates between the two groups of women?
They occur at higher rates for Black women. Why? It's because again, it's not taken seriously. I'll use, for example, we know folks like Serena Williams or even our Beyonce, who they face life-threatening pregnancy complication. And I use those two individuals because a lot of times I think, Cynthia, when we talk about this issue, folks have a particular individual in mind, right? They think about someone who may not have access to quality health care, or they may not, have the resources, or not, they may not be able to navigate the system. But you think about Serena Williams, who, I mean, famous, I mean, top tier tennis player, and then Beyonce, who, I mean, her tickets sell at a at a top tier rate in the music industry, and they face life-threatening pregnancies. And why? Because they weren't listened to when it came to some of their complications. And yes, Black women experience worse outcome regardless of your education level or income level. And so it's just it's really heartbreaking when you really think about
Yeah.
it, because it doesn't, again, going back to my comment about, I think there's when folks hear Black maternal health, they think, oh, okay, it's women in a certain geographic area or at a certain educational level or income level. And I think about even someone like myself, who I have access to all of the resources. I have access to, great quality care, and I'm very educated in this area. However, if I think about, if I didn't have the provider that I did, what could have been my story?
Hmm. So two women, equally educated, same income, same medical condition, um, and one is Black and one is white. And the difference in the outcomes for those women is likely to be the response of the healthcare system.
It's the
Is
response.
that what we understand?
Yes, medical bias. A lot too, when you look at these stories, it's stress from systematic racism. What is that? That weathering that chronic stress that really weakens Black women's body over time, which we can even, dig into. And access barriers too. Hospitals serving Black communities. If we want to talk about, women who are in some of the you know the different geographical areas that may not have access to those resources. When you look at some of these hospitals in these areas that may not have the same adequate resources, fewer resources and lower quality care, right? So again,
Mhm.
it isn't just, to your point about healthcare, it's about the systematic racism that are causing these women to die.
Mhm. Yes, yes. So let me ask you this: the research um, distinguishes between the factors that are associated with race,
Mhm.
being a particular race, and the factors associated with racism. Can you explain that difference?
Sure. So there's many studies on this, and oftentimes, folks say, "Oh, well, racism isn't a risk factor." Yes, it is. Yes, it
And how
is.
do we know?
I mean, just even some of these stories, right? Let me be clear too. Race itself. So, and I have seen this too. I want to back up. I have seen this where um, there are some pilot studies, and there are certain organizations just nationally who are trying to look at getting race as a risk factor, right? Because to the question that you asked earlier, you have a black woman go in and a white woman go in. You don't know anything about them, and automatically, that black woman more times than likely will have a poor outcome, right? And so there are entities that are trying to say, race should be a risk factor when it comes to being a Black woman. However, Black women's bodies are not biologically predisposed to have worse outcomes. However, instead, the stress, let me be clear, the stress, the bias in the medical care, and the social inequities, drive disparities, right? If I'm stressing, someone who is educated, someone who has the resources, but if I'm stressing based on, the things that I'm seeing around what's happening with Black maternal health, that's already
Mhm.
going to cause, me to my body to have that weathering that I talked about, where it's, you're the stress from systematic racism, where I'm thinking, oh my God, am I gonna be able to go home with my baby and my family?
Mhm. Mhm.
Although I like to consider myself someone who is optimistic. However, that feeds into our psyche, right? Regardless, because we read it, we see it. Um, but medical racism could lead to, delayed or denied care. "Oh, I'm not gonna go to the doctor. I can just wait." Or, that pain I talked about a little earlier, that pain and symptoms being ignored. Oftentimes, you read where, uh, Black women will say, "Oh, it's pain. Maybe I'll just wait," because they're scared to go to a medical provider, because they're gonna get brushed off, or they're gonna, say it's not a big issue. And then that unequal treatment, even with insurance, doesn't matter if you have top tier insurance, you may not get that great care if you have top tier insurance, because if your provider, already has a bias about you, it doesn't matter, right? So
Mhm.
until we really address, again, the racism in healthcare and societies, these disparities, they'll continue.
Yes, yes. You mentioned social inequities. I would like to ask you, what are the social determinants of health? We, some of us have heard that phrase before, social determinants of health. Some of us have not. So, talk about what are some social determinants of health in this topic area, and what do we know about them
Yeah.
relative to maternal health?
Yeah, sure. So really, when you think about the social determinants of health, or I like to call them the SDOH, these are really the non-medical factors that influence health outcomes. So when we think about, for example, housing conditions, what access to housing do birthing, Black birthing people have? Food security, things that you really think, oh, this doesn't really tie into maternal health. But if I don't have access to healthy food, how am I going to have access to a healthy birth outcome? If I don't have if I don't have adequate health, housing, how am I going to, be mentally stable to say, okay, I have a great place to lay my head? If I don't have, the educational access to understand what resources, if I don't have the economic stability, right? Employment, things that we kinda, I like to say, take for granted.
Mhm.
So really those non-medical factors when it comes to maternal health, these all play a huge role in maternal health outcomes and birth outcomes. And I say that because if a mother can't access quality prenatal care, healthy foods, safe housing, um, her pregnancy will definitely suffer in some way.
Yes, for sure. Those of us who work, as Bill does, all the time, across systems, have an understanding of that. Um, and also, it's something that I think that needs to be talked about even more. So, if we were to talk about some cross systems types of policy solutions, you know, if we've now gotten to the point where we're saying, okay, this is not a medical situation. This is not just a medical problem. This is not, something's wrong with Black women's bodies.
Right.
This is a bigger, broader, more complex problem, right? It involves all these different social determinants.
Right.
Um, and you mentioned a number of different things that have corresponding systems. Housing has a system that corresponds to it, right? That you talked about food insecurity, you talk about economic security. All of those social determinants are reflected in our human service system, in our broader system, not just our medical system, right?
Right.
So if someone was to ask you, which I'm about to right now, someone were to ask you, um, what kinds of policy solutions cross the different systems that you would share with people to understand how those outcomes can be improved?
Sure. So some of these that that just off the top of my head that I will definitely mention, or let me say this, are happening in some of our states, our cities, etc. So for example, Medicaid expansion, really extending postpartum coverage for at least 12 months, right? Really, because we can't say, once mom has baby or that birthing person has a child, that's it, they'll be fine. But really extending that postpartum coverage for at least 12 months, so to ensure that those mothers are doing well. A bias training for healthcare professionals is extremely important, because I talked about it, I talk about it over and over again, ensuring that Black women's voices are heard. That is important. And if you're able to understand that that are biases that you walk in the door with, and not knowing that there are biases that you're struggling with, then you're not going to be able to hear concern when that Black birthing person is addressing it, right? So really educating our healthcare professionals about bias. What does this mean when someone is addressing or presenting an issue to you? Your patient is saying, "Hey, I'm having this issue. I'm having this concern, whether it be physically, mentally, emotionally, etc." And then another thing is holding stronger accountabilities for our hospitals to really track those racial disparities and enforce change. I was on a call with some colleagues the other day, and there are states who are really trying to look to get their hospitals certified through parents, where it's like, okay, this hospital is doing really great because they're kind of certifying their hospitals to ensure that their providers are doing what they need. So I really think holding hospitals accountable is something that is going to be beneficial, because when you're tracking those racial disparities, it leads you to what I talked about earlier in this conversation, action, right? It's really saying, okay, definitely there's some disparities. We need to create change, and what does that change look like? And then also one that is really taking a launch in the nation is funding doula services and midwifery, more access to culturally competent providers, right? When we talk about doulas and midwifery, this is not something that's new. And I think a lot of times folks hear it, they're like, oh, it's this new innovative thing. Midwifery and this culture competent practice has been around for centuries. And so, and it's something where a lot of Black mothers feel safe. So why aren't we taking that, funding that, and allowing for those moms and birthing people to get the access to care that they need through these really safe practices.
So let me ask you a little bit more, excuse me, about doulas and the practice of midwives in healthcare. Um, do you want to share some of the history of how the process of um, birthing babies got taken over from the midwives, you know, by the white male dominated profession of OBGYN? Uh, do you want to tell that story a little bit?
Sure. I mean, this is something where we've seen it where, historically it was always Black women, midwifery, midwives, our doulas, our mammies, our mamas, grandmas, aunties, etc., providing that birth in home, and babies would live. They would thrive, right? And
Mhm.
then to your point, Cynthia, it then was taken over by these large systematic hospitals, um, white providers, especially men. And now, when we even fast forward, um, we see still that midwives provide holistic, patient-centered, let me be clear, patient-centered care that reduces medical interventions, right? So it and then even when we think about, our doulas advocating for mothers and helping them navigate the healthcare system, not only are they there to help with the birthing process, but they're there to really say, "Hey, I'm here as a support team. I'm here to support you." So really having that cultural competent provider understand, whether it be through lived experiences of black women, and provide respectful care and be that advocate. We've seen in some states and cities across the nation where it has reduced maternal mortality, infant mortality. And these models, not only, and I talked about me having, cesareans earlier in the conversation, but these models lead to lower maternal mortality, not only lead to a lower mortality rates, but fewer C-sections and better birth experience, right? Because I think that's a lot of times, um, I've read and I hear where women will say, well, I didn't want to have a C-section, but I was told I had to. And then come to find out I really didn't need to, right?
Mhm.
And
Yeah.
so it's that wasn't the case for me. My situation is a little bit different. However, there are women who didn't need to have that invasive surgery, that is definitely what it is.
Mhm.
And then, you know, thank God be able to survive, but didn't need it. So I think, again, going back to your question, uh, we have to give credit to where credit's due. Midwives have always been the forefront of healthy birth, right? And when it was taken over, it it's just something where we have to get back to, this is a practice that have always been safe in our community, have always provided care, and not just that physical care, but that emotional support, that mental support that mothers need during this time.
Yes. Can you, for those who might be watching this and don't know, can you say what is the difference between a doula and a midwife?
Yeah, so a midwife, most of the times, if you really want to just understand it, they can provide a little bit more of that patient centered care. Where a doula typically, they can provide help with the birth, but it really is that they really serve as like an advocate. But midwives, you can get certified as a midwife, and really provide kind of that patient-centered care, really, where doulas really serve as kind of an advocate, prenatally and postnatally, if you wanna look at it, in a cookie cutter way.
Hmm. So midwives actually deliver.
They can. They can work with the
Do
mhm.
doulas deliver?
Doulas can help with delivery. I know doulas are becoming even more, um there are doulas where I know there are doulas who are kind of being they're in there at the birth, but they can't do the birth as the midwiferys or the midwives.
Okay.
Mhm.
And then we know that a lot of states are looking to seek ways that expansion of the workforce of doulas and midwives can occur. What are states doing to try to have more midwives available to people, to have more doulas available to people, to have more people who want to be a doula or a midwife, to be able to be trained, to be able to make a living doing these things? What are states doing to promote all of that?
Yeah, so I can just tell you now, there are states who are looking to reimburse doulas and midwives at a higher rate through Medicaid, right? Because when you think about some states where there are a lot of Black women who are accessing the Medicaid system, and they want a doula but may not be able to afford a doula. Medicaid is providing that higher reimbursement rate to doulas, which I think is amazing, right? Because if I'm someone who I want a doula or I want support from a midwife, but I don't have the means or the access, then there goes my luck, right? But if
Mhm.
I know that, oh, I can get access to a doula through my insurance, then I'm more likely to look into that access to care. So I really like that a lot of states and jurisdictions are looking to reimburse doulas and midwives at a higher rate because when you look at, I don't have the specific numbers, but if you look at the rates, in some states, they're not top tier, right? So we wanna be able to provide, uh, compensation to doulas and midwives, how we
Mhm.
provide, compensations to our healthcare physicians and, those folks, we wanna be able to provide, a good compensation to those who are supporting, healthier birth outcomes.
Absolutely.
Yeah.
Okay. Well, suppose I am watching this interview and I'm saying to myself, well, what can I do to help? How can I advocate? What would you say to folks that are interested, individuals or communities or organizations that are interested in advocating around this issue of the improvement of Black maternal health outcomes?
Oh, how much time do we have?
We got a little more time.
I'm like, okay, how much time? No, seriously. I mean, that's a great question. Really, we have to support Black-led maternal health organizations, right? There are tons of organizations that are working to really tackle this issue and not just support them, but what can they do to ensure that action is being taken, right? I said that in the beginning as well too, because we know that this is an ongoing issue, but now it's what are the steps to take to ensure that that does not continue to happen. Advocate for policy change. That's a huge one, right? And it's oftentimes a large one, but how can, look at what policies are in your states, look at what policies are in your jurisdiction. Are they policies that are outdated? Are they policies that we really need to look at and say this doesn't make sense for everyone, right? And then to my point earlier about hospitals, looking at our hospitals, like demand better hospital care, speak up about the bias and disparities that are happening. We know that they're there. What does it look like? If you are a healthcare professional, regardless of what level you are at, you've seen something. It's kind of the, see something, say
Say something.
right. So really demand better hospital care. Educate and amplify voices. What does that mean? Share your story. Again, I said this earlier in the conversation too, that yes, I'm a professional in this work. However, this is very personal to me. So therefore, I'm going to share my story to raise awareness. This isn't just, me coming on and talking about the statistics, but then also sharing my story as a Black mother who has been in this space to raise awareness of the issue and to really raise the awareness to those who didn't have a voice and who those unfortunately had to transition through this unfortunate practice and then the system. Honestly, Cynthia, change really happens when communities push for systematic reform, right? When we say there's an issue, it doesn't just take one person, it takes multiple people, right? So you and I coming on here and having this conversation and saying, "Hey, we know that there's an issue. We know that there are things that are happening. What do we need to do in order to start chipping away at the larger issue at hand?" And that's really those are just some of the things that I think and need to occur and that I'm passionate about.
Yes, yes. And a lot of others are passionate about it as well. You're not alone, right? And neither would anybody who's watching right now who might decide that they want to be an advocate in this area. They would not be alone either. Um, so for our final question, let me ask this. It's always important to have a vision. Can't really, get to where you're trying to go to if you haven't um, clarified where it is you're trying to go.
Right.
So in terms of a healthcare system that actually prioritizes Black maternal health and that actually delivers um, really good, healthy, thriving outcomes for Black moms and families, what does that system look like? What is the system we're in pursuit of? What does that look like?
Oh yeah. So every Black mother receives respectful, high quality care. And I say respectful because that is important. Right, and I think again, when we think about respect, we think, "Oh, you're coming in, you're getting the care, and you're leaving out," and there's sometimes the indirect disrespect that occurs, right? Those small microaggressions that we don't talk about. So every Black woman, every Black mother, every Black birthing person receives respectful, high quality care. I talked about midwives and doulas. They need to be automatically integrated into standard maternity care. It shouldn't be, oh, if it should be they should be integrated into this larger system. They were before without even, thinking about it. Now we got so technical, but they need to be integrated into the system. Um, Again, hospitals, they have to be held accountable. What does that look like? Are we rating our hospitals? What are you an A hospital or are you a D hospital? And if you're a D hospital, why are you a D hospital? And do all women, okay, all women have access to the A hospitals because they should, and there shouldn't be any D hospitals. And again, if there are, what are we doing to fix those D hospitals? And maternal health is treated really honestly as a public health priority and not a privilege. This should be a priority. I know we talk about maternal health being, on the top tier of public health, but is it a priority? And when we talk, when we even, get it even in a more streamlined, is Black maternal health a public health priority? And I don't think it has been the way it should be, because there has been a lot of talk, and I don't say that lightly, but we need to also talk about the action behind it. And really just a system that ensures Black mothers and babies not only survive, but thrive, okay? Because we see that, Black babies, yes, they're born, but then whether it be preterm, a mom not being able to breastfeed her baby right away, being in the NICU because of something that was preventable. So that's what I mean by, yes, they're surviving, thank goodness, but were they able to thrive in the same way? So those are some of the things that when I think about what does a healthcare system that really prioritizes, Black women. Those are just some of the really top ones that come to mind.
Okay, very good, very good. Well, I think that people will learn a lot when they listen to you talk in this interview. Any final words before we close?
Yeah, I think, the conversation has to continue. What does that look like? I'm always open to having the conversation because this is something that I'm passionate about. And again, it doesn't just take one individual; it takes a community. Black maternal health is a human rights issue, and the solutions exist. It's really it's time for action, and Black mothers, we deserve better.
Absolutely. All right. Well, thank you. Thank you so much. And I'm just going to give a little thanks to the folks that might be watching this recording on the exchange. So thanks, everybody, and goodbye.
Thank you.